Hello everyone. I welcome you all for today's session. I am Dr. Priyanka here, educator on Unacademy, and today I am here to take a very special series for you guys, that is image-based question from pathology, from entire pathology. So as you all know, in the latest and new pattern in all competitive exams, whether you talk about NEET PG, whether you talk about FMG, INICT or next, we have a pattern that in which image-based question IBQs are there. So you are 25 to 30% of the paper, 25 to 30% of the questions from the entire paper will be image based. So it is a big area and it is a new pattern questions in which a image based question will be given in your exam. So here in pathology, I am going to launch this series today. In pathology from the entire Robbins, I will cover all images of the Robbins here. I will cover entire images of the Robbins here. So here I have divided, just a second, I have divided the entire pathology. You know, we divided into three portions. We have general pathology with us. We have hematology with us. And we have, of course, the most important systemic pathology, right? So I am going to cover the image based question from all of them, right? I will cover image based question from all of them. So I will start today with hematology. In hematology also, we will divide it into three portions. First, I will take all the images from WBCs, that is leukemias. Then I will take all the images from RBC disorders, that is anemias, RBC inclusions, RBC shapes, everything. And then we will come on platelet disorders, right? And few image based questions on the blood transfusion, the blood bag, and the other things, right? So first we will finish this one by one. After that, I will come on systemic pathology. In systemic pathology, I am going to cover all 10 systems, right? I will start from CVS, then GIT, then RESP, then CNS, right? CNS, then renal system, then genital, MGT, FGT, the breast in female, and other small systems are also there, bone and soft tissue. So we will do image based question of all these systems one by one, and all the images will be from Robbins and Cochrane, right? So all the images will be from Robbins and Cochrane. So we will decode the entire Robbins, and in the end, after completing systemic pathology, I will come on general pathology. So in general pathology, we will basically cover the 5 systems. That is, we will start from cell injury, cell adaptation, cell injury. After that, we will move on the second chapter, that is inflammation. Then we will move on hemodynamics, right? Hemodynamics. Then we will move on neoplasia. And in the end, the most important, the genetics, right? So we will cover these 5 systems, the chapters one by one, the images, the image based question. So that is the, overall the plan ahead, what we are going to do in the next few days in this series. So daily you will get one lecture on image based question, and please believe me, it is a very useful series for you people. For pathology, pathology is such a subject in which many image based questions can be created. So let's start with hematology. Without wasting time, I am starting with hematology today. So let me start image based question from the hematology. Before that, I'm having an announcement for you guys, the newcomers, for the newcomers student who don't know that on Unacademy we have 2 types of paid subscription along with the free classes. In paid subscription we have plus subscription and we have iconic subscription. In plus subscription, you will get access of live and recorded lectures of Unacademy only. But in Iconic, along with Unacademy, you will get prep ladder access also. So if you guys are thinking of taking any paid subscription, according to me, according to my advice, you should go with Iconic, because the price difference between Plus and Iconic is very less. But here in Iconic, you are getting all the features of Plus along with additional feature of the prep ladder, right? And these are the various plans you can see in front of you. These are the plans of the Plus, and these are the plans of the Iconic. Whatever plan suits to you, you can go with that plan. As small as short as 3-month plan is also available, as long as 4-year plan is also available. You can check the prices of all plan, and you can notice one thing here: longer the plan, cheaper it is. So if you are a first prof, second prof student, I advise you to take a longer plan, because per month wise it will be cheaper for you. And on any plan, before payment, if you apply my code, that is Sachdev10, SACHDEV, that is my surname, Sachdev, SACHDEV. Sachdev 10 is the code. If you apply it before any of the plan, before payment, you will get straightforward maximum discount from the team. So after this announcement, I would like to start image-based question series from the pathology, that is Robbins decoded. I will decode the entire Robbins image in front of you. Let me start with hematology. The first, I'm starting with hematology. Then I will move on systemic pathology, and in the end we will do general pathology as I have discussed the plan. So in hematology, let me start with WBC disorders. Okay. So leukemias and lymphomas is the area from which many images will be there and image-based question can be created. Before coming on the questions, I will show you questions also with the 4 options, the MCQ questions also with the image-based. I would like to give you a little bit about the theories of leukemias. Let me start with leukemias first. So leukemias. No, leukemias is such a topic. Most of the students find it very, fearful. They just get afraid that leukemia is a difficult topic. No, it is not. So I will just super simplify the leukemias for you, and I will show you all the images of all leukemias in front of you. Right. So the basically important leukemias are 4. You know the 4 important leukemias: CML, AML, ALL, and CLL. These are the 4 important leukemias, but we will do other also, the non-Hodgkin's lymphoma and Hodgkin's lymphoma also, and other leukemias also. Hairy cell leukemia, Burkitt lymphoma, leukemia. We will do all. So one by one we will do. So before that, I would like to give you a little bit about the theory. You understand the concept, see the images, then we will solve the questions, right? There are 5 types of WBC in human body. There are 5 types of WBC. What are the types of WBC? There are granulocytes and there are agranulocytes. Agranulocytes, right? Granulocytes are of 3 types. Granulocytes are known as granulocytes because they have granules in the cytoplasm. So neutrophil have purple granules, pink to purple granules in the cytoplasm. Eosinophil have brick red color granules in the cytoplasm, and basophil have dark blue or black color granules in the cytoplasm. Agranulocytes are the cells which do not have granules in the cytoplasm, of course. So here 2 cells are there. Number 1, monocyte, and then second is lymphocyte. You can see the images of all of them in front of you. You can see this is neutrophil having pink or purple granules. This is eosinophil having red granules, and this is basophil having dark blue or black granules. This one is purple, right? These 3 are granulocytes, and these 2 are agranulocytes, that is lymphocyte and monocyte. They do not have granules in the cytoplasm. So these are the 5 type of WBC present in human blood. My blood, your blood, all human blood have 5 type of WBCs. From where these WBCs are synthesized? My next question. From where these WBCs are synthesized? So except, okay, so you can see except lymphocyte, the remaining 4 WBC, that is all granulocyte, neutrophil, eosinophil, and basophil, and monocyte also from agranulocyte. These 4 are synthesized, all of them are synthesized, of course, in bone marrow. But in bone marrow, we have 2 series: myeloid series and lymphoid series. So these 4 are synthesized by myeloid series, and this one is synthesized by lymphoid series. Now please make your concepts crystal clear, right? What I am saying here, have a look. So these are synthesized from myeloid series, and only lymphocyte is synthesized from lymphoid series. Okay, let me draw a sketch diagram for you students to understand the concept well. Can you see a bone? You can see. Can you see inside the bone? There is a cell, bone marrow. Inside the bone marrow, there is a cell that is hematopoietic stem cell. So the first cell, the father of all cell, right? The ancestor of all cell is the first cell, hematopoietic stem cell. From this cell only all RBCs are formed, all WBCs are formed, and all platelets are formed. All blood cells are formed from hematopoietic stem cell inside the bone marrow. From hematopoietic stem cells, 2 cells are formed. This is myeloblast. Myeloblast. And this is lymphoblast. This is lymphoblast. So 2 cells are formed from hematopoietic stem cells. See, myeloblast will convert into promyelocyte. Promyelocyte will convert into promyelocyte will convert into myelocyte. Myelocyte will convert into metamyelocyte. Metamyelocyte will convert into band form, and ultimately it will result in neutrophil. Not only neutrophil, it will form neutrophil, eosinophil, basophil, and monocyte in the same way. So these are the precursors of neutrophil. How neutrophil is formed? You tell me. What is the sequence of formation of neutrophil? So the first cell is myeloblast. Myeloblast. After that, there are many cells in intermediate, but you have to learn the intermediate series also. So myeloblast, promyelocyte, PM, myelocyte, metamyelocyte, promyelocyte, myelocyte, metamyelocyte. band form, and ultimately neutrophil. Have you got it? In the similar way, eosinophil is also formed, basophil is also formed, and monocyte are also formed. All of them are formed from the first cell, myeloblast. This is myeloid series. Look the other way around. Look the other way around. The first cell is lymphoblast. Lymphoblast form only one cell, lymphocyte. So prolymphocyte and lymphocyte. So lymphoblast convert into prolymphocyte and prolymphocyte convert into lymphocyte. Have you got it? And this series is known as lymphoid series. So we have two series, myeloid series. The first cell is myeloblast, and lymphoid series. The first cell is lymphoblast. So we have two blast. We have two blast in the bone marrow. You have to understand the concept, huh? Myeloblast and lymphoblast. Myeloblast give rise to all these cells, that is neutrophil, eosinophil, basophil, and monocyte. And lymphoid series, the lymphoblast, give rise to only one cell, that is lymphocyte. And you should learn the intermediates also. There are 4 intermediates here and only 1 intermediate here. You should be able to learn the entire sequence. If you understood the concept, do you have any doubt till now? If you have any doubt, please write down in the comment box. I will definitely address it, right? So please see, if you understood the concept, let me move ahead. Now the final cell which is formed here, the neutrophil, I mean by neutrophil I mean all, neutrophil, eosinophil, basophil and monocyte. These all and lymphocyte from here, they all are coming in the blood vessel. They are, so the precursors are not coming in the blood vessel. These precursors, they are not coming in blood vessel. So if you see my blood, I'm having mature WBCs in my blood. The 5 mature WBCs, neutrophil, eosinophil, basophil, monocyte and lymphocyte. So these all are present in my blood, your blood, but we don't have these precursors. We don't have myeloblast in our blood. We don't have lymphoblast. But if you check my bone marrow, you will find myeloblast, lymphoblast there. So the precursors are present in the bone marrow, and the mature, the 5 WBCs are present in the blood vessel, Have you got it? So what are the cells of the bone marrow? What are the cells in the blood? Finally, final product is coming. The mature WBCs are coming, but their precursors are not coming in the blood. And the first precursor is the blast. This is the blast, the two type of the blast, myeloblast and lymphoblast. It is not coming in the blood. Have you got it? Now, what is the definition of leukemia? What do you mean by leukemia? Do you understand leukemia? In layman language, it is simply known as blood cancer. Blood cancer. Leukemia is blood cancer. So what do you mean by it? Blood cancer means what? Here, blast is coming in the blood. Myeloblast and lymphoblast are coming in the blood. Now, why they are coming in the blood? Inside them, some mutations are there. Some mutations takes place in their genes, in their nucleus, in their chromosomes. I will tell you the name of the mutations separately. So, because of these mutation, they do the cell division, or they do the mitosis, uncontrolled mitosis. They do uncontrolled division, uncontrolled. So they replace all other cells. They replace, because of uncontrolled proliferation, they replace all other cells, and they are coming in the blood. So if myeloblast is coming in the blood, it is known as myeloid leukemia. Myeloid leukemia, right? And if lymphoblast is coming in the blood, it is known as lymphoid. One of them will come in the blood. Lymphoid leukemia. So we have two types of leukemia, myeloid leukemia and lymphoid leukemia. Have you got it? It's very easy. Have you got it? Now, depending whether it is acute or chronic, so we will divide it into two types. One is acute, one is chronic, one is acute, one. So acute and chronic. Listen, acute myeloid leukemia, AML. Chronic myeloid leukemia, CML. Both of them are myeloid. So in both of them, myeloblast is coming in the blood. The other two, acute lymphoid leukemia, ALL, and chronic lymphoid leukemia. Both of them are lymphoid. So in both of them, lymphoblast is coming in the blood. I tried hard to explain you the concept. Have you got it? So we have 4 types of leukemia. You say 2 types or 4 types, whatever is your wish. So we have basic 2 types, myeloid leukemia, in which myeloblast come in the blood. Leaving the bone marrow, it is coming in the blood because of mutation in the myeloblast. And in lymphoid leukemia, the lymphoblast will come in the blood. Leaving the bone marrow, it will come in the blood because of the mutation. Now, depending whether it is acute or chronic. So, acute lymphoid leukemia, ALL, chronic lymphoid leukemia, CLL, acute myeloid leukemia, AML, and chronic myeloid leukemia, CML. So, basically, we have 4 types of leukemia with us. Everyone give me a thumbs up. Everyone, have you got it? Please give me a thumbs up in the chat box if you got it. So leukemias. The definition of leukemias, let me summarize. Leukemia is arrival of blast in blood. Blast in blood. That is the definition of leukemia. Please understand. So whenever blast is coming, normally blast is present, but not in blood. If you see my blood, your blood, any healthy human being blood, you will not get blast, even a single blast. If blast is present in the blood, it is known as leukemia. That is the definition of leukemia. Now, which blast is coming? There are two types of blast. Myeloblast is coming or lymphoblast is coming. Which blast is coming? So it is of two types. Now, which blast is coming? If myeloblast is coming, it is known as myeloid leukemia. And if lymphoblast is coming, it is known as lymphoid leukemia. Give me a thumbs up if you got it right. Now, the next step, depending whether it is acute or chronic, depending whether it is acute or chronic, it is of further two types: acute, chronic, acute, chronic. So acute myeloid leukemia, chronic myeloid leukemia, AML and CML, acute lymphoid leukemia and chronic lymphoid leukemia, ALL and CLL. So the summary is that in AML and CML, myeloblast will be present in the blood. Now, what is the difference between these two? How you will identify the different images of them? I will show you. In ALL and CLL, the lymphoblast will come in the blood. So I will show you the images of all the four leukemias if you got the basic. Now you will be able to understand the image. Now, as I have told you, the basic difference depends on that which blast is coming in the blood. As I have told you previously also, if myeloblast is coming, it can be myeloid. If lymphoblast is coming, it is lymphoid. So it is necessary to identify which blast is it. So you should know the difference between the two blasts. I will show you the diagram of myeloblast also. I will show you the diagram of lymphoblast also. You should be able to identify, is it a myeloblast or is it a lymphoblast? Depending on that, you will be able to identify which leukemia is it. Have you got it? I will come on that. Now let me come on lymphoma first. What is lymphoma? You got the definition of leukemia? See, the diagram is crystal clear in front of you. So you got the definition of leukemia. What is leukemia? In leukemia, the blast is coming in the blood. You know, myeloblast is coming in the blood or lymphoblast is coming in the blood. Leaving the bone marrow, they are coming in the blood. So it is known as leukemia. Give me a thumbs up. Now, after coming in the blood, if they enter in the solid organs, so solid organ can be spleen, solid organ can be liver, solid organ can be lymph node, or solid organ can be any other organ. It can be gonads, it can be other organs can be there, any organ can be there, right? So if any solid organ is involved by the blast, so blast enter the solid organ, so the size of the organ or solid organ increases and there is some lesion inside it which is made up of blast. This lesion inside the spleen, inside the liver is made up of blast. Now it is known as lymphoma. So lymphoma is blast in the solid organ. So let me summarize. Now these are the basics. These are the concepts you should know. Right? There is nothing to mug up. You have to understand the pathology. If you understand it, now I will show you the images of leukemias and lymphoma. It will be cakewalk for you. You already know the concept. You already know the concept. Okay, let me summarize. Right? So leukemia is blast in blood. Blast in blood. Do you have any doubt? No. Lymphoma is blast in solid organ. Blast in solid organ. So it is a solid tumor. It is a solid tumor, right? You can see it's identified and cut it. And blast in the blood, it is a liquid tumor. That's why it is known as blood cancer. It is known as blood cancer, right? And it is a solid tumor. Lymphoma is a solid tumor. Leukemia is blood cancer. Now, it is also of two types, and it is also of two types depending which blast. If myeloblast, myeloid leukemia, lymphoblast, lymphoid leukemia. If myeloblast, myeloid lymphoma, and lymphoblast, lymphoid lymphoma. So that is the basic definition, right? Have you got it? And again, we have divided the leukemias further into two types: acute myeloid leukemia, chronic myeloid leukemia, acute lymphoid lymphoma, chronic lymphoid lymphoma, leukemia. Sorry, not lymphoma. Sorry. These are the four leukemias. Lymphomas we don't divide in this way. Lymphomas we divide based on the Hodgkin cell. So I will come on that later on. Hodgkin cell. So there are two types of lymphomas, Hodgkin's lymphoma and non-Hodgkin's lymphoma. So lymphoma will be my second chapter. I will come on that in the next lecture. So today's lecture, the image-based questions from leukemias we are going to take. Now everyone, those who are watching whether live or recorded, please give me a thumbs up. Please give me a thumbs up in the chat box so that I can understand that you got the concept, or write down that you got the concept. So it is a beautiful concept and I really tried hard to make these sketch diagrams for you people so that the concept should fit in your mind forever, right? Okay, so this is the images from the books showing the same thing. You can see this is myeloblast. Read, it is a myeloblast. Myeloblast. From the myeloblast, what is the sequence I taught you? From the myeloblast, the first cell is promyelocyte, then myelocyte, then metamyelocyte, then band form. So this is myeloblast. This is promyelocyte. It will convert into myelocyte. It will convert into metamyelocyte. It will convert into band form, and finally neutrophil is formed. Finally neutrophil is formed, and neutrophil is coming in the blood. So this all are present in the bone marrow, and ultimately neutrophil is coming in the blood. You can see, give me a thumbs up if you got it. So this is how neutrophil is coming, and this is lymphoid series. So this is lymphoblast. The first cell is lymphoblast. Second cell is prolymphocyte, and it will ultimately convert into lymphocyte. It will come in the blood. Lymphocyte, and these two are present in the bone marrow, not in the blood. And here these all are present in the bone marrow. Okay, these all are present in the bone marrow, only the final neutrophil is coming in the blood. So you know the basics. Now we have 4 types of leukemia. In these two, myeloblast will be present in the blood. That's why these are myeloid leukemia. Myeloid leukemia. These two, lymphoblast, will be present in the blood. That's why known as lymphoid leukemia. So you got the concept, you got the classification. Now, as I have told you, here myeloblast is the main cell, here lymphoblast is the main cell. So what is the difference between the two cells? Both of them are cells. See the diagram of both of them. So you should be able to identify whether the blast is a myeloblast shown in the image or it is a lymphoblast. If it is a myeloblast, you have two options, CML and AML. Now, what is the difference between them? I will come on that. And if you have lymphoblast, again, you have two options, CLL and ALL. I will come on that also. First, understand the difference between the two types of cells. Yes or no? So you can see very clearly here, myeloblast is larger in size and lymphoblast is relatively smaller. That is the first difference. So size wise, if you see, the myeloblast is larger, lymphoblast is smaller. Cytoplasm wise, you see, so both have very less cytoplasm. Still, myeloblast have moderate. Can you see light pink color cytoplasm? Yes, you can see. So can you see this rim of side? This is the nucleus. This purple is the nucleus, and this is the cell membrane. So between the cell membrane and the nucleus, you can see a rim. And see, this is the entire nucleus. I hardly see a very minute rim of the cytoplasm. So cytoplasm is moderate in myeloblast and very scanty in lymphoblast. You got it? Give me a thumbs up if you got it. The most important difference here comes. The most important is the iron rod. Can you see a red colored rod in the cytoplasm here? A red colored rod. So a red color rod like thing is present in the myeloblast ka cytoplasm, but it is not present in lymphoblast. So iron rod is the main difference between them. It is present here, it is absent. It may be present, it is not always present, but here it is definitely absent. Right? The last difference you can see between them is nucleoli. Inside the nucleus, these are the nucleoli here. Inside the nucleus, these are the small nucleoli. So here nucleoli are prominent, here they are not prominent. Right? So these are the differences. The most important if you want to learn is the iron rod. So iron rod is present. The summary is that we have two types of blast, myeloblast and lymphoblast. The two type of blast we are having. So both are cells. This is the cell. This is the cell. So the first one is the larger, second one is the smaller. Myeloblast is larger, lymphoblast is smaller. Both have nucleus. So this is the nucleus inside it, and this is the nucleus inside it. Now where is the cytoplasm? Cytoplasm is between nucleus and cell membrane. So here we have, in the first one, we have moderate cytoplasm, and here we have very scanty cytoplasm. So that is the second difference between them. The most important is the presence of iron rod. Here iron rod is a red color rod present in the cytoplasm. Here it is present and here it is absent. Please learn it very beautifully. It is shown here. Please learn it. So you got the difference. Now, if you got the difference between myeloblast and lymphoblast, now you see, I will show you the image of the peripheral smear. I will take the blood sample of a patient. I will take it out in a test tube, and I will make a slide. I will make a smear. You know how to make a tongue-shaped smear. In this smear, when we see under the microscope, we will find the blast under it. Right? Now, looking at the blast, whether it is a myeloblast, the cell, or lymphoblast, we will decide which type of leukemia is it. So this is the basic concept, right? So you can see the differences I have already told you, myeloblast and lymphoblast. So size wise, it is larger, it is smaller. Nucleus to theek hai. Cytoplasm, here moderate, scanty, moderate, but iron rod is present. Here scanty, clear, no iron rod is present. So these are the basic differences. The same diagram showing here. See myeloblast, lymphoblast. See the iron rod, the red color rod. That is the biggest difference. Biggest difference. You can see nucleoli also. Okay, so you can see nucleoli are more prominent inside the nucleus here, and nucleoli are less prominent inside the nucleus here. So nucleoli is also a difference, size is also a difference, cytoplasm is also different, and the biggest difference is the iron rod, which I have told you. Now you got it, iron rod present in myeloblast, iron rod absent in lymphoblast. Please learn the concept. If you got this, the same diagram, I'm not repeating again, these are the iron rods. So iron rods, myeloblast, no iron rods, lymphoblast. So you can see the same. So coming on the summary, and let's come on the concept. So let me start the leukemias. We have 4 leukemias: CML, AML, the 2 myeloid, and ALL, CLL, the 2 lymphoid. Let me start with myeloid. Let me start. As you know the concept, both of them are myeloid. One is acute myeloid, one is chronic myeloid, but both of them are myeloid leukemia. So in both blood, myeloblast will be present. So your question to me, ma'am, how we will recognize whether it is the AML or CML? Both of them will have myeloblast, but how we will identify them? Now see, I'm going to tell you the biggest concept here. How to differentiate between these two. Which two? The two type of the myeloid leukemia, that is AML and CML. Okay. In AML, listen my words very carefully. In both of them, this is the series. This is the series which is abnormal. Lymphoid series is not abnormal. So in AML, only myeloblast will come in the blood. Only myeloblast will come in the blood in AML here. Only myeloblast is coming. That is known as AML. But in CML, all of them are coming in the blood. So along with myeloblast, you will get promyelocyte, myelocyte, metamyelocyte, band form, and neutrophil. Not only neutrophil, neutrophil ke saath eosinophil, basophil, monocyte, you will get everything. So you will get a mixture of cells in CML. So I will show you the diagram of both of them, right? So in CML, you will get all. All, by all, I mean starting from myeloblast. Myeloblast to hoga hi hoga. Of course, but after myeloblast, you will have promyelocyte, myelocyte, metamyelocyte, band form, neutrophil, eosinophil, basophil, monocyte. You will get everything in blood. That is CML. And if you say about the AML, the other myeloid. So here you will get only myeloblast, only myeloblast. So see the difference between them. See the crystal clear difference. So let me show you the images of both of them, and then we will move on questions. Okay. So CML ka image. This is the CML ka image. See CML ka image. In CML ka image, see the peripheral blood. What you are getting, what cells you are getting. Please see what cells you are getting here. So you are getting mixture of cells. So you are getting blast, myeloblast, promyelocyte, How you identify band form? You know, band forms are like C-shaped structure. The nucleus is C-shaped. So this is a band form here. Can you see? This is a band form here. This is a band form here. This is a band form, all C-shaped. This is also a band form. This is a main neutrophil. Can you see the blue colored one is the eosinophil? Okay, let me mark. This is a eosinophil. Sorry, the red granules. This is also a eosinophil, the red granules. This one is a basophil, the dark blue or black granules. This is also a basophil. So you are getting everything. You are getting promyelocyte, metamyelocyte, basophil, neutrophil, eosinophil, band form, right? You are getting everything. So this is the typical diagram of CML. So this is the real image. This is normal blood, this is CML. So in normal blood, you are getting the mature cells only. In leukemia and CML, you are getting everything. You are getting promyelocyte, myelocyte, metamyelocyte, band form, neutrophil, eosinophil, basophil, everything. So that is the difference. See the basic, beautiful diagram. Beautiful diagram. Okay, what is there in this diagram? I will show you. See, you identify what is this cell. I'm marking with red. You tell me, you see the nucleus, it is C-shaped. Yes, it is a band form. It is a band form. Okay, you identify this cell I'm marking now. This one, this one. See the red granules. Yes, red granules means eosinophil. The image is not very bright, but yeah. See this diagram I'm marking. What is it? The blue or black granules. It is a basophil. It is a basophil. Again, it is a C-shaped nucleus. That's why it is a band form. It is a neutrophil, the multilobated nucleus. It is a neutrophil. See the NC ratio. See the NC ratio. It is a blast. The myeloblast. It is myeloblast, right? Cytoplasm is granular and moderate, right? And apart from it, there are many cells. So some of them is promyelocyte, myelocyte, metamyelocyte. I cannot identify them well, but yeah, there is a mixture of cell I can see. So it is a typical diagram of CML. So I tried hard. Give me a thumbs up. The same diagram. The same diagram. You can identify the various cells. I'm not enumerating them again. The same diagram. You can see various cells. So what cells? This is a neutrophil. Okay. Let me change the color. This is a neutrophil here because it is multilobated. Which cell is this? Okay, I'm marking with green color. This one and this one. The blue granules, the dark blue granules. So these are basophil. This is also a basophil. Eosinophil is, I guess, not showing in this diagram. What is this cell? This one, C-shaped nucleus. It is a band form. What is this one? Again a C-shaped. It is also a band form. Maybe eosinophil is not shown here. So of course it is an image of, again, CML. Let me come on AML. As I have told you, in AML only myeloblast will be present in the blood, not all cells, right? So in AML only myeloblast is present. If only myeloblast is there, it is AML. If along with myeloblast all others are also there, it is CML. So write down crystal clear, they are coming in the blood. Everyone give me a thumbs up. So this is the diagram of AML. Okay, let me draw. So you can see this is the diagram. Everyone see, this is the diagram. What cells you can see? What are these cells? So these all cells are only one type of cells. Only one type of cells. These all, see the NC ratio. You understand NC ratio, nucleus cytoplasmic ratio. So NC ratio is high in blast. So these all are blast. They all have moderate or scanty cytoplasm, and some of them, let me mark some of them. Can you see this here? The red granules I'm marking with blue, red rods. The red rods here, the red rods here. So some of them have iron rods. That's why it is a myeloblast. And all of them, and see the nucleoli inside them. Please appreciate the nucleoli, the prominent nucleoli. Inside the nucleus, see the nucleoli. They are prominent nucleoli. So of course these are myeloblast and they are iron rods. Only one type. There is no band form. There is no eosinophil. There is no basophil. Give me a thumbs up. You can see the two myeloblasts are shown in front of you. This is also a myeloblast. This is also a myeloblast. The same, right? This is the nucleus here and this is the nucleus here. And this is the iron rod. Multiple iron rods here, cluster of iron rods in the cytoplasm. Here only one and two iron rods are there. So both of them are myeloblast. A myeloblast which contain iron rod inside it, these two one, is known as Fagott cell. Is known as Fagott cell. So Fagott cell is nothing. It is a myeloblast containing iron rod. Now in this diagram, some have iron rod, some do not have iron rod. So the one which have iron rod is Fagott cell. Fagott cell, Fagott cell. Rest are known as only myeloblast. So that is the concept. Again, the same diagram. Okay, let me draw. You can see this cell, and this cell. All of them are myeloblast because two of them have iron rod also. Here also these are the iron rods. Let me draw. These are the iron rods. These are the iron rods here. You can see these are the iron rods. So these all cells are myeloblast. These are, so any image can come in your exam. Okay, see this image. See this cell. See this cell. Okay, see all cells. All cells are same. This one. I'm marking जिसमें मुझे iron rod दिख रहा है. So I can see iron rod here. I can see two iron rods here. I can see two iron rods here. One iron rod here. So these all cells are myeloblast. So it is a diagram of AML. So see, appreciate the iron rod. So it is not the thing you have to learn that this image will come in your exam or this will come, this will come, this will come, this too will come, this will come. So any image can come. Learn the concept. Don't learn the image. Don't learn the image. So we have completed the myeloid leukemias. Give me a thumbs up, everyone. So I will come on lymphoid leukemias now. So myeloid leukemias. Myeloid leukemias are of two types, CML, AML. I have shown you the images of both of them. In CML, the main thing is that all cells will come. Myeloblast, promyelocyte, myelocyte, metamyelocyte, band form, neutrophil, eosinophil, basophil. Everything will be there in the smear. In AML, only myeloblast are there. Myeloblast containing iron rod. Write down iron rod in the bracket. So the myeloblast containing iron rod is the Fagott cell. So you can see Fagott cells in AML. Here it is not necessary iron rod is present. Here the clue is all cells are present. Here the clue is iron rod containing only one type of cell is present. That is the clue. So this is the summary. This is the summary of two types of myeloid leukemia. I really tried hard in explaining this concept to you. So please appreciate my work, hard work, and give me a thumbs up if you got the concept, right? And please write down your feedback in the comment box. Don't forget to write down your feedback in the comment box. Please, it is very necessary for me and very useful for me. So your suggestions and whatever you feel like this, you got the concept or you didn't got the concept, please write down. Okay. So coming on the lymphoid leukemia, we have two types of lymphoid leukemia, the acute lymphoid leukemia, ALL, and chronic lymphoid leukemia, CLL. So ALL and CLL are the, in both of them, these are lymphoids, so lymphoblast will come in the blood, right? Okay, see this diagram. Now, in the previous one, in the previous two, myeloblast was coming in the blood. If myeloblast was coming alone, it was AML. If myeloblast was coming with all other cells, promyelocyte, myelocyte, metamyelocyte band form, so it is CML. But in both of them, myeloblast was coming. That is the summary. Now, coming on lymphoid leukemia, if only lymphoblast is coming, only lymphoblast, so it is ALL. ALL. Like AML, it is ALL. So if only myeloblast is there, it is AML. And if only lymphoblast is there, it is ALL. What about CLL? CLL. In CLL, no blast coming in the blood. It is not myeloblast, not lymphoblast. Here, mature lymphocyte will come. See, this is the lymphoid series. Now, don't see the myeloid series. Cross it. Don't see. We are talking about lymphoid leukemia. So, see the lymphoid series. In lymphoid series, we have three members. The first member is lymphoblast. The second member is pro-lymphocyte. And the third member is a mature lymphocyte. So if you say about ALL, so in ALL, lymphoblast come in the blood. Only lymphoblast come in the blood. And if you say about CLL, so it is the mature lymphocyte which is coming in the blood. So you should ask, ma'am, if it is mature lymphocyte which is coming, so why it is known as CLL? Why it is a leukemia? Mature lymphocyte is present in me also, you also, but we have 30 to 40% of lymphocyte in our blood. Here in CLL, 90% of the cells will be the mature lymphocyte. It is not blast, I agree. It is lymphocyte only, but this mature lymphocyte is not normal lymphocyte. It is very fragile. It is abnormal lymphocyte. So I will come on the summary. Let me show you the images. So my point is that we have two types of lymphoid leukemia. Among the two types, in ALL, lymphoblast will come in the blood. And in CLL, mature lymphocyte, but it is mature lymphocyte, but it is abnormal. It is not normal like me, like you, like every normal human being. No, it is abnormal lymphocyte which will come in the blood. So this is the summary. Everyone give me a thumbs up if you got it. So I will show you the diagram of ALL first, then CLL. So CALL, ALL. In ALL, only lymphoblast will come in the blood. CALL. Now, can you see this diagram? Yes, of course, you can see this diagram. You can see. So all these cells, what are these cells? Everyone tell me. So these all cells are same. You can identify these are not different cells. See the morphology of all these cells. See the NC ratio. Can you see inside the cell, the dark purple color is the nucleus. Can you see light pink color? The cytoplasm, hardly any cytoplasm is present. Very scanty rim of cytoplasm in all of them. And of course, none of them have iron rod. So iron rod is absent. So of course, all these cells are lymphoblast, and it is a diagram of ALL. ALL. See this diagram. This can come in your exam. See this diagram. So see any of the cell, this. I can see only nucleus. I hardly see any cytoplasm at the periphery if you zoom it out. I hardly see any cytoplasm. All these cells, and no iron rod. All these cells are lymphoblast. In this diagram, I can see only one neutrophil. Rest all the cells are lymphoblast. So of course, again, it is the diagram of ALL. It is a diagram, the same diagram from a different book. So this can come in your exam, the answer is same. This can come in your exam, the answer is same. This can come in your exam, the answer is same. Learn the concept. Now all these cells are same. Again, the same concept. All these cells are same. It is not different. All these cells are same. And see the nucleus and cytoplasm. So cytoplasm ka this is the nucleus. And this is scanty rim of cytoplasm, and there is no iron rod in one, not even one of the cells is showing iron rod. So all these are lymphoblast, and the answer is ALL. One more clue for ALL. ALL occurs in child. ALL occurs. So read the clinical history. Age is very important. So in a child with this type of morphology, the answer is ALL. So again, the three lymphoblast. This, and this. Here the only nucleus is present. Cytoplasm almost absent. Here a thin rim of cytoplasm. Here also a thin rim. So all these cells are lymphoblast. All these. So same diagram. I'm not repeating again. I have covered the diagrams from all books, including Robbins also. All standard textbook. I have taken the diagram from. Right. So I have taken diagram from multiple books so that none of the diagram is missed from your eyes. Your eyes should be trained for all the diagrams. Right. So learn the concept. These all are same, and the answer is ALL. These all are lymphoblast. Let me show you the diagram of CLL. As I have told you, if you are talking about ALL, only lymphoblast will come in the blood. But if you talk about CLL, the mature lymphocyte will come in the blood, but these are abnormal. These are not normal. These are abnormal lymphocytes. Have you got it? Abnormal lymphocytes. So here lymphoblast was coming, and now mature lymphocyte will come in the blood. So this is the diagram. See the diagram of CLL. Now, okay, I would like to tell you something here before showing this diagram. Just suppose this is a patient in my clinic, and based on the history, age, symptoms, my probable diagnosis that I'm having suspicion this patient is having CLL. So how I will confirm? Being a doctor, how I will confirm? I will ask the patient to give a blood sample in a test tube, to take the blood of this in a test tube, right? So this blood contains mature lymphocyte. If I'm right, the patient is having CLL, so this patient have mature lymphocytes in the blood. So 90 or 99% of the cells are mature lymphocyte which are abnormal. What is the abnormality? The abnormality is that they are very fragile. They are very fragile. They are very fragile. So whenever you will make a smear, you take a slide, you take one drop of blood here, right? This is one drop of blood, and make a smear, tongue shaped smear. So how you make a smear? You take the slide, you take one drop of blood here, and you take a spreader, another slide at 45 degree. Yes, at 45 degree you just spread it, and you just spread it. Since all these cells are very fragile, as I have told you, so while spreading it, due to the pressure of the spreader, they just burst out. They just burst out. So on the slide you will get mature lymphocyte and some bursted mature lymphocyte. So some of the lymphocyte got bursted. They just got burst out. They just got burst out. So these bursted lymphocytes are known as smudge cells. I will show you the diagram. Smudge cells, or also known as basket cells. Basket cells. So this is the peripheral smear of a patient with CLL. In peripheral smear of a patient with CLL, you get two things. Number one, you will get mature lymphocytes, mature small mature lymphocytes, and number two, the bursted cells. Bursted, these are smudge and basket cells are present only on slide. They are not present in patient. They are formed during formation of the smear. So they are present on the smear in a slide. They are not present in patient. So while forming the slide, they are formed. So these are the artifacts. Smudge and basket cells are the artifacts of the smear. Have you got it? Have you got it? See, now see this diagram. Can you see two things? What are the two things you can appreciate here? These all cells, the cells you can see, these are small lymphocytes, mature lymphocytes. And can you see the purple thing here? The purple thing is the bursted form. They got burst up for the formation, during the formation. These are smudge cells or basket cells. So that is the biggest clue given in the question for CLL. See the image. See the image. Can you see the two things? Yes, you can see the two things. So these all are lymphocytes, number one, and these all are smudge or basket cells, the bursted form. Smudge or basket cells, the same diagram, the same diagram. These all are lymphocytes, and the bursted one, these all are lymphocytes, and the bursted one, this one, this one, this one, this one, these are smudge or basket cells. So this is a smudge or basket, and rest all are lymphocyte. So this is a smudge or basket, rest all are lymphocyte. So see how many images I have covered. How many? So who will give me the summary? Who will first give me the summary? Who will? Anyone among you? Yes, you will participate. So I taught you the two types of leukemia, myeloid and myeloid and lymphoid leukemia, right? Myeloid leukemia is of two types, AML, CML. Lymphoid leukemia is of two types, ALL, CLL. So what cells you will get them in their peripheral smear? So if I make a slide of all of them, so this is a slide, this is a smear, this is a slide, this is a smear. So on the smear of each of them, what cells you will found? I'm talking about smear. So in AML, you will found only myeloblast with iron rod. Iron rod is the biggest clue here. In CML, you will get myeloblast, but along with myeloblast, you will get promyelocyte, myelocyte, metamyelocyte, band form, neutrophil, eosinophil, basophil. You will get a mixture of cell. So the clue here is a mixture of cell. In ALL, you will get only one cell, that is lymphoblast. So here it is myeloblast with iron rod. Here it is lymphoblast without iron rod. Only one cell. In CLL, you get no blast. Here it was myeloblast. Here it was myeloblast along everything. Here it is lymphoblast, but here is no blast. Here you will get mature lymphocytes, which are abnormally fragile. Mature lymphocytes you will get. So since they are fragile, during the formation of the slide, they just got burst out, and this results in the formation of the smudge or basket cell. Smudge or basket cell. Now see the beauty. See the beauty. Now this is the summary. No one in this world will teach you with this simplicity. So see, in AML only myeloblast, in CML along with myeloblast everything, in ALL lymphoblast, and in CLL mature lymphocyte with smudge and basket cell. So this is the summary. Now if I give you any image based question, you can correlate it. You can correlate it. So everyone have a look. So this is AML, because I can see only one type of cell with iron rod. Please appreciate the iron rods. This is ALL, because I can see only one type of cell without iron rod. So these are myeloblast, all the cells, and these are lymphoblast, all the cells, all the cells. In the third diagram, I can see a mixture of cell. I can see myeloblast, promyelocyte, myelocyte. See the band forms. The clue here is the band form. the C-shaped multiple band form. The clue here is the basophil. The clue here is the eosinophil. Beautiful diagram. So it is CML. And see the fourth diagram. See the fourth diagram. I can see two things. Number one, mature lymphocytes. And number two, I can find out the smudge or basket cells. So it is CLL. I cannot super simplify than this. I cannot. I want everyone to appreciate it. Please write down in the chat box whatever is your feedback. Please write down regarding this, the summary. Please write down, please. So please write down in your notebook this. Everyone make the rough diagrams in your notebook so you can see the four types. You can see the four types. The same thing. You can see the four types. So same thing. So I would like to show you some questions now based on leukemias. Now it will be a cakewalk for you. You can answer all the questions. So we will do four questions based on one type on each type of leukemia. We will do four questions. So this is the first question in front of you. I will read the question for you. Don't worry. A 45-year-old male, age is always a clue. So he is a middle-aged male with an 8-month history of fatigue. Okay, let me tell you one more thing here. So this is the bone marrow. Inside the bone marrow, the first cell is the hematopoietic stem cell, right? From the hematopoietic stem cell, myeloblast is formed and lymphoblast is formed, right? So from myeloblast, promyelocyte, myelocyte, metamyelocyte, band form, neutrophil, eosinophil, basophil, everything is formed. Monocyte, everything is formed. And here prolymphocyte and lymphocyte is formed. So whenever there is a mutation in myeloblast or lymphoblast, due to the mutation, they do abnormal uncontrolled cell division, abnormal uncontrolled mitosis. So because of which they replace all other cells. They replace all other cells. So there is either only myeloblast or lymphoblast because of the mutation. But from hematopoietic stem cell, not only myeloblast, lymphoblast is there. RBCs are also formed and platelets are also formed apart from WBC. So since the mutation is there, so this myeloblast is replacing RBC and platelets also. Lymphoblast is replacing. So all four leukemias. We have studied the four types of leukemias now. AML, ALL, CML, CLL. All will result in anemia. So anemia is the clinical symptom of all leukemias. All the patients with leukemia will have anemia. The reason I have told you, because the myeloblast or lymphoblast will replace the RBCs. Because of uncontrolled mitosis, they just replace them, right? So they just over-occupy them, right? So all will have anemia. Not only anemia, anemia is due to less RBC. The patient will have less platelet also. Platelets are also replaced by the blast. So patient will have bleeding tendencies. It can be purpura, it can be, nasal bleeding, epistaxis, purpura, it can be other bleeding forms also. So all patients with leukemia have anemia. All patients with leukemia have bleeding because of less RBC and less platelet. All patients with leukemia have infection. Now you will say, ma'am, why infection? The patient is having less RBC, less platelet, but patient is having more WBC. WBC is replacing the RBC and platelet. Now it is the WBC which is replacing RBC and platelet. I agree that WBC is more, but it is not the mature WBC which is more. It is the immature blast, myeloblast or lymphoblast which is more. So it doesn't give the defense. So no defense is there, so patient have infection. So all leukemias have three symptoms in common. So less RBC which leads to anemia, less platelet which lead to bleeding, but more WBC. Still they are non-functional because they are blasts. They are not mature WBCs. So infection. So these are the features common in all four leukemias. It is AML, ALL, CML or CLL. All four leukemias have anemia, have bleeding, have infections. Give me a thumbs up. Now read the question. Now read the question. So a 45-year-old male is there with an 8-month history of fatigue. Fatigue means anemia. The patient is having anemia. That's why the patient is presented with fatigue and marked splenomegaly. Hemoglobin is 9. You can see 9. The patient is anemic. The patient, normal hemoglobin, 13 to 17. Here it is 9. Platelet count is almost normal. It is normal. And see the WBC. WBC is 2,50,000. What is the normal range of WBC? It is 4,000 to 11,000. So it is raised. It is abnormally raised. Now you have to tell me three answers. Three questions. It is not an MCQ. I'm not giving you the options. Three questions, three answers. The first question, see the image and tell me the type of the leukemia. See the image and read the clinical history. Now this is the image given to you. The clinical history given to you, the age of the patient is 45 years. Patient is presented with anemia. Patient is presented with bleeding and patient is having high WBC count. High WBC count, that is 2,50,000. This is the image. Now what you can see in the image, let me give you the clue. So can you see what cell is this with red granules? It is a eosinophil. What cell is this with black or blue granules? It is a basophil. And what cell is this with a C-shaped? It is a band form. What cell is this with a high NC ratio? It is a myeloblast. It is a myeloblast. Now, based on the mixture of cells and clinical history, of course, we all know the diagnosis is CML. The diagnosis is CML. So my answer here is CML. So with this question, with this image, you have four options: CML, AML, ALL, and CLL. So go with CML. It's very easy. What is the mutation of CML? So with the same image, I will give you the same history. I'm not asking the diagnosis. I'm giving a difficult question. See the image and tell me the mutation in this disease. So it is a two-step question. First, you identify the diagnosis, and then based on the diagnosis, you give what is the mutation. So we all know in CML, the mutation is 922. The translocation between two chromosome 9 and 22. So it is known as ABL-BCR translocation. So ABL-BCR. So whatever you say. So answer is CML. Answer is 922 or ABL-BCR, that is Philadelphia. Philadelphia. I hope you know it. What is the therapy given? So based on the same image, my question to you, what is the therapy given? Name one drug, the targeted drug for CML. One drug, only one drug, only one drug. Yes. So the answer is imatinib. Imatinib. It is the first targeted therapy. So answer here is imatinib. So any question based on this image, I can frame three MCQs. What is the diagnosis? Your four options is the simplest question. What is the diagnosis? AML, ALL, CML, CLL. So the answer is CML, of course. Based on the same image, I am asking what is the mutation? Is it 922? Is it 1814? Is it 1214? Or is it 19? So I'm giving you these four options. So it is 922, of course, based on this image. Based on the same image, I'm asking the third question. What is the therapy? Is it paclitaxel? Is it imatinib? Is it I can give you two more drugs? So the answer is imatinib. Right. So image based question can be framed on any point. It is not the thing you should see the image and you should mug up. No, understand the concept. Now any question based on it can be framed and you can be able to answer. So here not one MCQ. I can frame three MCQs here. Three MCQs. Everyone give me a thumbs up. So that was the first question. Right. Coming on the second question. This is the second question. I will read it for you. Don't worry, and I will show you the image separately also. Right. See, a 41-year-old male is there. Again, the middle-aged male is there. Present with fatigue. Fatigue का मतलब होता है anemia. Patient is having anemia, that's why fatigue. Fever का मतलब होता है infection. Patient is having anemia, infection. And petechiae and epistaxis का मतलब होता है bleeding. Patient is having bleeding, that's why petechiae and epistaxis. Now see the three typical features of leukemia. So patient is having anemia. Author or examiner has not given you directly anemia. Indirectly, anemia is indicated by fatigue. Indirectly, infection is indicated by fever, and indirectly, bleeding is indicated by petechiae and epistaxis. So patient is having these three symptoms. Hemoglobin C, it is 6.7. Of course, the patient is having severe anemia. Platelet is only 9,000. 9,000. So patient is having less platelet also. Less RBC, less platelet. But see the WBC. WBC is 1,68,000. It is more. 4,000 to 11,000 is the normal range. See the peripheral smear. See what all cells are this. So what is the diagnosis? What is the diagnosis? My first question. The four options are same. Is it AML? Is it CML? Is it ALL? Is it CLL? What is it? So see the cells. Everyone see. All the cells are same. All these cells are same. First thing. Only one of them is different. So just neglect it. This one. Okay, this one. It is a band-shaped or neutrophil, but rest all are same. And they have iron rods. Most of them have iron rods inside them. Don't miss out this iron rod. That is the biggest clue given to you. So, of course, one type of cell with iron rod. So, all these cells are myeloblast and answer is AML. So, answer is AML. So, my first answer is AML. Can you explain the clinical findings? Why patient is having fatigue because of anemia? Because the myeloblasts are replacing the RBC. So RBCs are less. Why the patient is having petechiae? Because myeloblasts are replacing platelet also. So platelet are less. So patient present with petechiae and epistaxis because of bleeding. And why the patient is having fever? Because of the infection. WBC are more, I agree, but they are non-functional. All of them are blast. They are non-functional. So you should be able to explain this. What is the prognosis? Prognosis is very poor. Very poor. Relapse is very common and prognosis is poor. And patient presents with pancytopenia because of the presence of iron rod. We have identified these are myeloblast and it is AML. It is AML. Give me a thumbs up. Coming on the next question. The next question. It's very easy. Very easy. Straightforward diagnosis is asked. Okay. I will read it for you. Don't worry. So 80-year-old. So old age is the clue first. Presented with painless cervical lymphadenopathy. Peripheral smear is shown. In the peripheral smear, you can see two things. Of course, you all are right. Write down your answer. You all are right. So, okay. So two things are seen here. The lymphocytes. These are mature lymphocytes. And second thing is this bursted cell. Bursted. They just burst out. So these are the smudge or basket cells. Smudge or basket cell. And these are the Mature lymphocytes. Give me a thumbs up, mature. So based on this, of course, the diagnosis is straightforward. It is CLL. So correct answer here is CLL. Should I proceed to the fourth question and the last question? So smudge and basket cells I have taught you. This is the last question in front of you. You all can see. A very beautiful question. So see, age, he is a child. The biggest clue given in the question. Child में कौन सा ल्यूकेमिया होता है? Only one leukemia in the child. Presented with fatigue. Fatigue का मतलब है anemia. I taught you fatigue means anemia. Epistaxis and bruisability means bleeding. Means bleeding. So anemia means less RBC. Bleeding means less platelet. Right? And pneumonia. Pneumonia means infection. Patient is having infection. So on examination, patient have bone pain, splenomegaly and lymphoadenopathy. Peripheral smear is shown. Tell me the type of leukemia. So see, what are the clues given to you? He is a child, number one. He is having anemia. He is having bleeding, anemia. He is having bleeding and he is having infection. The typical three symptoms of leukemia. So definitely he is a child and based on the symptoms, he is having leukemia. Now see the peripheral smear. See the peripheral smear. So all these cells are same. These all cells are same looking. All these cells are same looking. They all are same. Give me a thumbs up. And none of them have iron rod. And see the cytoplasm, it's very scanty rim of cytoplasm, right? So these all are lymphoblast. So the answer is ALL and he's a child. So ALL occurs in child. Please learn. You can explain the clinical findings and yeah, name of enzyme. Let me summarize one more thing. As I have told you, we have two types of blast, myeloblast, lymphoblast. What were the differences between them? What were the differences? Myeloblast is larger in size. It is smaller in size. The main difference is iron rod. So iron rod present here, iron rod absent here. Cytoplasm is moderate here. Cytoplasm is very scanty here. The last difference between them, one enzyme is typical in each of them in the cytoplasm. Here in myeloblast, the name of the enzyme is MPO. That is myeloperoxidase enzyme is present in the cytoplasm of the myeloblast. And here the name of the enzyme is TDT. TDT is present in the cytoplasm of the lymphoblast. So the diagnosis is ALL. So they have lymphoblast. So what is the enzyme present in the lymphoblast? It is TDT. TDT. The full form of TDT is in front of you. It is TDT. It is terminal deoxynucleotide transferase. So any question can come in your exam. Can I summarize? Can I summarize? So myeloblast, lymphoblast, the two types of leukemia based on acute and chronic, the four types of leukemia, AML, ALL, CML and CLL. And what is coming? So based on myeloblast and lymphoblast, iron rod, you can differentiate them. So this is the summary in front of you. Do you have any doubt? Do you want me to summarize it again? So there are four types. It is AML, it is CML, the two myeloid. It is ALL and CLL, the two lymphoid. Just tell me the name of the cell. Here only myeloblast. Here only lymphoblast. Right? Here myeloblast with iron rod. Iron rod is the clue here, right? And here scanty cytoplasm without iron rod is the clue. In CML, along with myeloblast, promyelocyte, myelocyte, metamyelocyte, band form, neutrophil, eosinophil, basophil, everything you will get a cocktail of cells, right? And here you will get mature lymphocytes. Mature lymphocytes with smudge cell or basket cell. Everyone give me a thumbs up. Everyone. So this is the summary. Now you can identify all image based question based on it, right? Okay, so thank you very much for being with me. I would like to stop here and please don't forget to attend the next lecture of the series in which I will start the RBCs. That was the WBCs. Now I will take lymphomas also and I will take RBCs also. So before that, I would like to give you a few announcements. So thank you very much for being with me. I really enjoyed teaching you. Hopefully same from your side also. So daily I take classes in the morning, the free live classes from 9:30 to 1:30, 9:30 a.m. to 1:30 p.m. in the morning daily. So my some of the classes are on YouTube channel of Unacademy, that is Let's Crack NEET PG. Some of the classes on YouTube, Future Doctors of Unacademy, and some of the classes on special classes on Unacademy platform. But the thing is that all the classes are free. So you can attend them. You can attend them, right? Don't forget to write your feedback in the comment box. Please enumerate the topics which you want in my classes, in free classes. So please enumerate the topic. I will try to take a small lectures on that topics. Now, what you have to do, you have to install Unacademy Learners app. Unacademy Learners app from the Play Store. right? After installing that, select the category as NEET PG. There are various categories. Select your goal as NEET PG. After selecting goal, search my name. My name is Dr. Priyanka Sachdev. Dr. Priyanka Sachdev. You will find my name under educators there, plus educators. Along with my name, a profile link is given. Please follow it. Please follow it. Click it and follow it. There are two advantages of doing so. If you follow my profile link, you will get all the notifications before my classes, before my free, so you will never miss my free class. Number one, you will get notification 15 minutes before. The second thing, you will get a list of recordings below my profile link. So I am having more than 500 free lectures already taken, so you can watch any recording, any recording. The only thing, you will require a code to unlock it. The recording is free, but you require a code to unlock it. The code is my surname only, Sachdev. So code is SACHDEV. Sachdev is the code. Sachdev 10. Sachdev 10 is the code. So please note down this code and distribute this code to all medicos in your contact, on your batch groups, everywhere. And this is about the free classes. On Unacademy, we have paid classes also. We have two type of paid subscriptions, Plus and Iconic. If you take Plus, you will get only Unacademy live and recorded lectures. In Iconic, we will provide you Unacademy and Preparator together. So if you are thinking of purchasing a paid subscription, go with Iconic. It is better and price difference is very less, right? In paid subscription, you will get all 19 subjects, complete syllabus, along with test series, along with question bank, along with mock test, along with everything. So it is a combo, right? And it is very cost effective, right? So you can see the various plans. You can see once you take the subscription, you will be eligible for all these features. You can see the various plans. So these are the various plans of Plus, and these are the various plans of Iconic. So in Plus, only Unacademy. In Iconic, Unacademy plus prep ladder, right? See the minimum. There is 3-month plan, maximum 4-year. So you can see minimum. So whatever fits you, you can take that plan. You can give a trial for 3 months if you want to give a trial first. Longer the plan, cheaper it is. So if you're a first prof, second prof student, go with a longer plan, 3-year, 4-year plan. It will be cost effective for you. But whatever plan you are selecting, before payment, if you apply my code Sachdev10, you will get straightforward 10% or maximum discount on the subscription. So please use the code and distribute this code on your batch groups and everywhere. So code is useful in two ways. The code is Sachdev10. Those who want to watch the free classes only, do not want to take subscription right now, so they can watch it for free, but using this code they can unlock the free class. And those who want to take the subscription, the paid subscription, they can get discount before payment if they apply this code. So the code is useful for all students. So thank you very much for being with me. Please like, don't forget to click on the like button if you like the lecture. Don't forget to drop a comment, your suggestion, your feedback, and subscribe our channel Let's Crack NEET PG, and download the app, that is Unacademy Learners app. Thank you very much. Share the link with all your friends, colleagues. See you all tomorrow in the next lecture. Bye bye. Study hard. Bye bye.